Does a community hospital offer urgent care? Cranbourne people are asking this question because their brand new hospital didn't have urgent care for minor injuries.
The reality is that people are confused about what the Cranbourne Community Hospital is actually delivering. We continue to get questions about, well, does it have an emergency department? What hospital services does it provide?
I think when people heard hospital, they just presumed that they would be getting urgent care services. So they're very disappointed that hasn't been delivered.
And now that concern is spreading. Not far away in Pakenham, locals fear their soon-to-open community hospital could follow the same path, delivering day procedures and clinics, but just no urgent care. But let's stop it here. Why do so many people think that Cranbourne Community Hospital does have urgent care? Was it a misunderstanding from the start? Or did something change along the way? When I went back through our news archive to find an answer, the picture got blurry. Some early stories say it is the expansion of the Cranbourne Integrated Care Centre which doesn't offer urgent care. Others mention the existence of urgent care and even outline what a community hospital would offer. And even now, the Victorian Health Building Authority's website still lists after-hour urgent cares as one of the promised services. But this isn't about the definition anymore. Cranbourne residents are clear. They need a hospital with an emergency department or urgent care centre.
I know the demands on the current GP services in Cranbourne, and it is very difficult to get a timely appointment with a GP. My daughter had a lot of ear infections when she was little, and we could never get into a local GP, and we'd always be travelling to Narre Warren or Berwick to access urgent services. And I feel that the Southern Casey community deserves access to urgent care because the current services can't keep up with the demand, and our growing population is only going to place more demands on our urgent care services.
With such a growing population, the demand for health services is growing more and more, and the existing services are struggling to keep up. And that's no criticism of the really hard-working health service staff, whether it's in Casey Hospital, emergency departments, in general practice, or any health service. But the reality is that we have a growing population, an ageing population with more complex needs, and we need health services where and when the community needs it. And right now we don't. And the local community were promised an urgent care clinic here at the Cranbourne Community Hospital, and it hasn't been delivered.
Star News Violet Lee reports.